I've lived in New York on and off 5 years, 6 years. I've been ill for 10 years without a break. I've never been in remission, so I have active tumors that cause a lot of pain on a day-to-day basis, every single day. My entire adult life, I've been ill. I have felt ill. When I was in college, I was diagnosed at 19. I was young and optimistic, and I felt pretty confident that the tumor I had, it would likely never come back. I was on my parents' health insurance and lived in Cincinnati. My parents handled all of the bills, and I never had to look at them, I never had to see them. I didn't have any money, I was in college. I couldn't have paid them anyway. So I was very optimistic for 2 years. Then it just snowballed out of control. We found the tumor in my hip and also a recurrence in my calf. So we had 2 tumors suddenly to deal with. The first talk was of amputating my leg at the hip. I flew to Texas 2 days later to be seen by a surgeon at MD Anderson, which is the best cancer hospital in the nation. The care that was recommended at MD Anderson was external beam radiation on my hip, which we didn't necessarily think was going to work because it hadn't worked on my calf. And it turns out that radiation saved my leg and my life. I don't know how, but it worked, and that's the best part of my story. After I graduated from college, and around the time of my surgery, I hadn't been employed or in school for a while because I had to have surgery, and it was a very difficult time for my parents because of course they were going to find a way to do this and pay for insurance and keep my certificate of continuing coverage. They would do anything to never let that lapse. And they had to buy an individual policy for me. After the COBRA ran out, they had to go and seek an individual policy. So they went to different insurance companies. A few of them told them that no insurance company would take me on because they could see the pre-existing condition I had, and it wouldn't be worth their while, which terrified my mom. I remember her crying and endlessly. She was terrified to hear that I couldn't get a policy, I couldn't be insured. They finally did find, I think it was Blue Cross, I don't remember exactly. It was a horrible amount. It was $1,500 a month.
Did they not cover hospital visits 100%, or?
I don't believe so. I think it was 20% out of pocket for hospital visits. You know, the insurance paid for things, but not without a fight. So any drug I started taking, you know, they would immediately say it wasn't covered. The medicines I take, which cost $200 a month with my copay. Without them, I think it would be something like $6,000 a month. I need them to be well. I can't not have those medicines. The insurance companies would say this is a stage 2 drug. You have to prove that you've been treated for this condition before. When there was a list of things that I'd done for cancer this long, that I'd had surgery 3 times, I'd had radiation twice. It was just, it made no sense, and they wouldn't cover these drugs.
So you're saying your doctors would recommend care and the insurance company would fight the care that was recommended?
Every time. I've never had a positive experience with an insurance company. I mean, it's never ending. The numbers I see are very stressful. This one, for instance, is $1,260. I don't understand even what it's from. I couldn't even tell you what it is for. So many things are affected financially by the fact that I have cancer. If I can own this apartment, if I can get married, if I can qualify for free care at Sloan. And at the time, my insurance considered Sloan out of network. The first year I was treated there was for an FDA study of a drug called Gleevec. And the only thing that was actually free, even though it was a government-sponsored study, was the medicine itself. I got an MRI every other month. I had to pay for that. I saw the doctor every week. I had to pay for that. I had to take blood tests every week. I had to pay for that. And at the end of that year, what I was responsible for was about $80,000 worth of bills. And I was baffled. I didn't know what to do. I was 26. I didn't have $80,000. So that's when I would talk to the financial people at Sloan, and they would say, if you pay it all now, we'll give you 10% off. That didn't help. They said, we can put you on a payment plan. That didn't really help. And finally, after talking to them for months and months, they said, well, we do have this program. If you apply for it, you can get financial aid. This was after months and months and months of talking to them and having these bills amass and them sending them to collection agencies or threatening to. That changed my life because that meant every bill that I got from Sloan Kettering I could disregard. So I didn't have to look at it. I didn't have to pay it. I didn't even have to know how much any of it cost. And that was very liberating. I'm on a COBRA policy. Since I moved to New York in 2005, I had worked for a small children's publishing company and had insurance through that job and worked there for 3.5 years. And last April was my last month with them, April 2008. And so it's been a year and a month now that I've been on COBRA. So we're approaching 18 months. What will happen to me if I lose my certificate of continuing coverage? It is all that I think about. So this is stress on a level I've never experienced before. So really what cancer couldn't do as far as causing me stress, insurance has done.
Yeah.
And I am more stressed about my current situation with my insurance than I am about my disease right now.